Hi everyone, this is the Scrutinizer, aka Dr. Meenakshi Noll. So, we are in the middle of a pandemic, and what are the problems that we are facing? The problems I want to discuss are misinformation, distorted truth, and so much information out there that doesn't even make sense. And this is why the scrutinizer has stepped in. And as you all know, the scrutinizer is against misinformation. So, why do I say that misinformation is so harmful or is a major threat? Misinformation in any case, first of all, is harmful. It makes you make wrong decisions because you don't have the entire picture of what you're facing. So, taking the example of COVID-19, it's because of the distorted information that people are not taking the correct steps to help eradicate the virus, and thus the virus has gone out of control in the United States, while the other countries have pretty much contained the threat. So far in United States alone, 96 at least 96,000 people have died, and the latest is that Europe has only 15 cases per million people, while the United States has 192 cases per million. So, what happened, or what is the problem? The problem is that for information, people go to Dr. Google, and Dr. Google has rarely any facts, but or if there are facts, they are not complete. So mostly people go ask Dr. Google, and there would be opinions or the latest fad, and then they think that's the truth and they go along with it. So, what's the point I'm trying to make? The point is facts, that science is about facts and not belief or opinion. So, what are the facts right now? The facts are we are facing a novel virus that gets A plus in being a virus. What does that mean? The goal of any living being is survival. And the goal of a virus is to infect as many people it can and transmit so that it can survive. And the impressive thing about this coronavirus 19 is that it lives in cold blooded animal like cobra, and how quickly it not only jumped from cobra to warm blooded animals like us, the humans, but it adapted to infect us. And then it also adapted to transmit itself from human to human, thus surviving or reproducing. And the goal is to infect as many people it can. Its infectious machinery is set up is that it infects people, but it will not kill all the people at once. Because if all the hosts are gone, it has deliberately killed itself. But, just to say. So, the second fact would be that this virus is killing people regardless of age, sex, and race, whatever the opinions or information might be floating around. So we have in United States created a messy situation by not following science. And I would reiterate that disease is about science and medicine. And science and medicine is about facts, not opinion. The opinions change with time, peer pressure, money, or anything, but the facts always remain the same. So, how has America handled the pandemic? The analogy of the pigeon comes to mind because pigeon is the only bird when it sees its arch enemy, the cat, it closes its eyes and it thinks if it cannot see the cat cannot see it, and so it is safe. But in this process, it gets eaten. So the same way there are majority of Americans don't even believe that there is a virus out there or there is a pandemic out there because they cannot see it, so it doesn't exist. Or they say that their rights are being violated. Social distancing, why? Or mask, we don't cover our faces in America. Seriously, this is not about personal preference or fashion statement. This is about how to handle or eradicate a virus. So, but I would answer by saying hopefully the surgeons in America do cover their faces while they perform surgery. And better one, the last, more interesting, what the fact or most interesting opinion floating around is virus is no match for us. We got immune system. Seriously? If immune system could do all that, we would have had no diseases at all. So what's the truth? The truth is that we should not even have faced the pandemic. This is the most advanced country. The preparedness of CDC was 83%. That is the highest in any country in the world. So, what happened? Did CDC betray the American people, or is it incompetent, or both? So, what should have CDC done to begin with? First of all, an epidemic or a pandemic, it doesn't come with a warning. It doesn't announce, a virus doesn't announce, oh, hello, I'm coming, get ready. No. But in this case, we got lucky that the moment China went to WHO to say there is an epidemic in China, and we knew that it's coming. So that gave CDC ample time to strategize, make their testing kits. Also, the genome sequence was published even in mid December or so from Cobra. And so there was ample time for us or for the CDC to make a plan and issue statements to people. However, it seemed that they did nothing. They took it very lightly. Either they didn't believe it or I have no clue. But they should have closed the doors of the country. What that means is the international travel. And I'm not saying that people should not be able to come home. However, if the airports were closed, then they could contact and trace and quarantine the passengers. And that way, we could have contained the virus outside the states. I would give the analogy of your home. Let's say your friend is visiting, but he says that they are facing a highly infectious disease like dengue fever or cholera. Would you close your door and tell them to get better first, or would you let them in and entertain? Similarly, we were supposed to close the doors. And what did we not do? Why are we in this messy situation today? Because we did not follow science. Majority of people in the US have refused to follow science, and CDC did not follow the mandatory steps that are dictated by epidemiology to protect the people from the disease. They did not announce anything to the public as the pandemic was approaching or it approached. Rather, their statement was not to worry and it is a mild flu. And then they issued a statement stating only the old people or the people uh, who don't have a good immune system, they are being infected or they are dying. So this made the rest of the people think, and the young people think, okay, they are immune to the disease, which is not even true. And for the longest time, CDC did not have a testing kit. They knew that the epidemic or the pandemic is coming, and they could not make a working um, testing kit. And this is RT-PCR or a serology. And recently, Robert Redfield, the director of CDC, he said that this virus has brought America to the knees. We have done everything we could. Has he done everything he could? Where I sit, or looking at all these facts, it seems no, they did nothing. Um, nothing to protect the people. Even now, they have not issued a statement informing people so that they can understand clearly what's going on and what measures to take to protect themselves. Rather, they are still giving a wrong information in the sense regarding their testing kit. So it is an RT-PCR, which means usually in Europe, I hope it's the same test here, and usually in Europe it is 97.7% correct. But this means there is a margin of error, and there would be false positives or negatives in the test, in any test. So CDC is stating that if you are positive with this test, it does not mean that you are exposed to coronavirus. It could mean that you have just a flu, which is so not true. I mean, how are we able to distinguish between the viruses then? What's the point of the test? So, what they need to say is that if you are found positive, it means that it could be a false positive or negative, although highly unlikely. So, this seems to be part of the reason that there is chaos right now in the United States. And this is only a glimpse of what majority of American people think, and the topics and the misinformation that is floating around. I have a whole slew of topics to discuss in the hope that people would gain correct information and take the measures to help eradicate the virus, to keep everyone healthy along with themselves. So these topics are mainly, I have chosen from the comments or messages that I have received to clarify from people. For example, of course they don't understand the, if you're not a scientist, you don't understand herd immunity, flattening of the curve. However, there are people, they would just spread wrong information regarding it. And then I'm also going to discuss the stem cell companies. There are a couple of stem cell companies that are giving false hope to the patients. I mean, nothing is more inhumane than than trying to make a buck off the dying patients. So I would actually show this stem cell company, the director, what he's saying, and FDA has given them approval for a clinical trial. When, if anyone who has studied stem cell biology, they know that stem cells is not some magical entity that can read your mind and do whatever you're thinking they should do. Okay. And then there is Harvard professor interested in precision medicine. Now adds to misinformation by stating that this pandemic should have been handled by using precision medicine. Seriously? He hasn't, he or we, even precision medicine is not even here yet. We have not even done it for regular diseases like diabetes management. And pandemic can never be handled by precision medicine because by the time you're looking at every person, the virus spreads and people die. So these are a number of topics that I would discuss. And if you're interested in the facts, and I hope you are, you could subscribe to my channel so you know when the Scrutinizer has posted the new interesting facts. In addition, you could click the bell button below to turn on the notifications. And if you found the video interesting, you could hit the like button. And if you have comments or you want any other topics, based on science to be discussed, you could write them in the comments and I would do my best to address those. And lastly, like I always say, think critically, stay healthy, the Scrutinizer